Good morning. Today I'm going to Pehla PPT. Today I'm going to teach you about the breastfeeding. So, what are the objectives of today's lecture? Why I'm teaching you the breastfeeding? So, specific learning objects of our today's lecture is that at the end of this lecture, you should be able to know that what is the anatomy and physiology of breastfeeding, what is the composition of breast milk and its various types, benefits of breastfeeding to baby and mother, and factors which reduce its secretions, correct techniques and position of breastfeeding, storage of breast milk, then what are the contraindications? There are very few. And the problems encountered, what problems encountered during breastfeeding and what are their remedies, so we can ensure the successful breastfeeding, and what is the nutrition to the mother should be given while she is breastfeeding her baby. Next, next slide. Next slide. So today I will tell you what is the anatomy and physiology of breastfeeding. So you, as you are all aware, you have studied the uh, structure of the breast in the anatomy. That it consists of the glandular tissue, fatty tissue, and supportive tissue and fat. So milk is secreted by these glands, which are known as the lactiferous glands, and the secreted milk travels through the tubule or duct, which drain into the lactiferous sinuses. The sinuses, which store small quantities of milk, lie below the areola. So they open out at the nipple through the lactiferous ducts, and this thin layer of muscles or myocilium surrounding each gland. The contraction of these muscles causes ejection of the milk, and on areola there are small Montgomery glands which produce the oily fluid to keep the nipple skin moist and soft. So now you are aware that this milk is secreted here, which is surrounded by the myoepithelium, and by the through this gland it will travel into the lactiferous sinus, and then into the lactiferous ducts, and then into the collect into lactiferous sinuses which open at the nipple. Now, how is the milk produced and it's secreted? Milk is produced as a result of the interaction between the two hormones and two reflexes. During pregnancy, the glandular tissue is stimulated to produce milk due to the various hormone influences, and the areola and the nipple are extremely sensitive as they are supplied with a rich network of nerve endings. Time पे ध्यान रखना. Now, first reflex is the prolactin reflex. So it is evident by the name that it is under the influence of the hormone prolactin, which is secreted by the anterior pituitary gland, and it is responsible for milk secretions by the mammary gland cells. And when the baby sucks, the nerve endings in the nipple they carry message to the anterior pituitary, which in turn releases prolactin. The earlier the baby is put on the breast, so the sooner will be this reflex initiated, and the breastfeeding will be successful. Then the more the baby sucks the breast, the greater is the stimulus for milk production. The greater is the demand of milk, larger is the volume of milk produced. Now, second reflex is the oxytocin reflex or milk ejection reflex. Oxytocin is a hormone produced by posterior pituitary. It is responsible for the contraction of myoepithelium around the glands, leading to the ejection of the milk from the glands into the lacteal sinuses and the lacteal ducts. This hormone is produced in response to the stimulus to the nerve endings to the nipple by sucking of the baby, as well as by the thought, sight, or sound of the baby. So should be aware, as soon as the baby, as the mother thinks that she has to feed her baby, or if she listens her cry, the milk starts secreting from her breast. So these are all the stimuluses which are also responsible for the secretion of milk. And that is why at the time of breastfeeding, the mother should be relaxed, unstressed, and comfortable. Now, what are the factors which decrease the milk production? Using dummies, pacifiers, bottle interferes with the secretion and predisposes baby to diarrhea. Pre-lacteal feeds and supplemental feeds, like in the form of honey or sugar syrup or jaggery, if they are given before the initiation of the breastfeeding, they interfere with the milk secretions. Then painful breast conditions like sore and cracked nipple, engorged breast, they also interfere. And we will, at the later part of this lecture, I will tell you about these problems and how to encounter these problems and what are the remedies. Then lack of night feeding, as prolactin is produced more in the night and its lack, prolactin reflex is not adequately stimulated. Then incomplete emptying of the breast. As we know, we should advise the mother to give, if she's feeding 2 hourly, then at a time she should completely emptying one side of the breast, and after 2 hours she should offer her second breast. So there is to ensure a complete refilling. And complete emptying will be ensuring complete refilling of the breast. Now, composition of breast milk. It contains 88% of water and rest all are nutrients. What are these nutrients? First is the proteins. Two types of proteins are there in breast milk. That is 60% is whey protein and 40% is casein. So it is in the ratio of 60-40 approximately in the breast milk. Then lactoferrin inhibits the growth of iron-dependent bacteria in GIT. Then secretory IgA protect the infant from viruses and bacteria. Lysozyme is an enzyme which protects against E. coli and Salmonella. And bifidus factor supports the growth of the lactobacilli. Now, what are the second solids? Fats. It is rich in PUFA. What is PUFA? It is polyunsaturated fatty acids. It is necessary for myelination of nervous system. Long chain fatty acids are needed for brain, retina, and nervous system development. Long chain omega 2 and 6 fatty acids are important for formation of prostaglandins and cholesterol. Then vitamins, all fat and waste soluble vitamin, fat and water soluble vitamins are minerals. Breast milk are sufficient till 6 months of age, and the amount and types of various vitamins in breast milk is directly related to the mother's vitamin intake. Like suppose if the mother's diet is rich in vitamins, the baby is less likely to suffer from the vitamin deficiency as the baby is getting sufficient amount of trace elements and vitamins through the breast milk. Then carbohydrates, lactose and galactose. Lactose is the primary carbohydrate found in the human milk, which helps in the absorption of calcium, phosphorus, and magnesium. It enhances the growth of lactobacillus and decreases the amount of unhealthy bacteria. Now, what are the types of breast milk? The composition of breast milk varies at a different point of lactation to suit the need and the demand of the baby. Like milk of a mother of preterm baby is different from the milk of a term baby. So first we'll learn what are the different type of milk. So what is the colostrum? It is the thick golden yellow milk secreted in small quantity during first 3 days after delivering after delivery, and it is very rich in antibodies. That is why it is also called first vaccine of the baby. It should be given to the baby. It should never be discarded. People have a lot of ignorance that it is a bad milk and it should be discarded. And mind, if you are discarding it, you are doing a very, very much harm to the baby as you are depriving her from the antibodies which will protect her till 1.5 months of age till you start the vaccination. Okay, so this is the first food should be, this should be the first food of the baby. Whatever amount, little amount, 2 or 3 drops it is coming, should be given. Second is the transition milk. It is the milk secreted after 3 to 4 days till 2 weeks. The Ig immunoglobulins and protein contents decrease while fats and sugar contents increase till it comes to the composition of the mature milk. So what is the mature milk? It follows the transition milk until the termination of breastfeeding. It remains the same. It is thin and watery, but contains all the nutrients essential for the optimal growth of a baby. That is why we tell that there should be exclusive breastfeeding up to 6 months of age, as all the nutrients required by the growth by the baby for optimal growth are present in the breast milk. Nothing else is required. Even water is not required. Then I told you in the beginning that preterm milk is different from the term milk. How it is different? Milk of mother of a baby born less than 37 weeks of weeks, it is a preterm baby, and the composition of that milk of that mother, it will contain more protein, fat, sodium, iron, and immunoglobulins and calories as per the requirement of preterm baby. Concentration of calcium, phosphorus, and lactose is lower. During 2 to 3 week, composition changes to the mature milk. Now, composition of milk also varies during a single feeding also. Like in the during one feed, initial milks which come is known as the fore milk or early milk. That is more watery in nature. It is secreted at the beginning of the feed and it is rich in lactose and proteins, vitamins and minerals. And this water satisfies the baby's thirst. And the milk which comes in the later part of the milk, it is hind milk or later milk. It is released towards the end of the feed and it is richer in fat contains and provides more energy and satisfied baby's hunger, and it will increase the weight of the babies also. So both fore milk and hind milk should be given to the baby during a one feed. So complete emptying of the breast will be ensured by this, and there will be a better refilling also. And next time, second breast should be offered to the baby. Now we should know what are the advantages of breastfeeding to the baby and to the mother. First, I will tell you what are the advantages to the baby. Baby, it is for baby, it is a ready-made, readily available at any time of desired temperature. It is available and no risk of adulteration or contamination, dilution or infection of breast milk. Second, it is a species specific. What is species specific? Like there are many species, as the goat, cow. For their children, the cow and the goat gets a composition of milk which suits their needs. So human milk, human babies, they need whatever the nutrient give, it is specifically present in the mother's milk. So it is species specific. Then breast milk is a complete food with all the essential nutrients for growth and development till 6 months of age. So babies should be exclusively breastfed till 6 months of age. Healthy term breastfed babies do not need any supplemental vitamins or iron or water. This is, I'm insisting repeatedly that you should know the importance of exclusive breastfeeding. What is exclusive breastfeeding and till what age it should be given? It is more easily digestible due to the presence of special enzymes, lipase, and high quantity of whey protein. Then breast milk contains a number of anti-infective substances, protective antibodies, and friendly lactobacillus, which protect the babies against diarrhea, respiratory infections, and other infections, especially infections which are shown to decrease the risk of death due to the diarrhea by 14 times, acute respiratory infection by 4 times, and the other infections by 3 times. This is a reduced risk of otitis media and necrotizing enterocolitis in the breastfed babies also. Breastfed babies are less likely to suffer from allergies disorder like asthma and eczema. It provides immunological benefits throughout life. Breastfed babies have shown the developmental better protective response to various vaccines and compared to the bottle-fed babies. It provides emotional support, security, and promotes close bonding between the mother and the baby. And breastfeeding stimulates all the other 5 special sense organs like touch, sight, smell, hearing, and taste. Then these babies are smarter and have 8 points higher IQ and enhanced visual activity, visual development, and brain growth due to the high concentration of two key long chain fatty acids. Breastfed babies are less likely to suffer from dental caries, diabetes, hypertension, and heart attacks, obesity, certain cancers like lymphoma during adult life. The risk of SIDS, that is sudden infant death syndrome, is also less in breastfed babies. And these children are less likely to suffer from various psychological problems and behavioral abnormalities of childhood. Now, there are uh, benefits to the mother also. What are the benefits to the mother? Dhruv, कितना मिनट हो गया तुमने देखा 3 मिनट और ये टोटल कितनी चीज तुमने शेड्यूल करी है 13 minutes. तो फिर वो उसको बंद कर देना अब सेकंड पीपीटी चालू करना शॉर्ट स्टेचर Index lecture, short stage. Yes, slides very good. Good morning. Yes, sit down, all of you. Today I am going to teach you about the short stature. So, what is the outline of my lecture? What is the general objective? By the end of this lecture, you will be able to know definition of short stature and its causes and types, how to approach a child with short stature, how to differentiate between normal and pathological causes of short stature, diagnosis, differential diagnosis, and the outline of the management. So what is the definition of short stature? Short stature can be defined as height below third centile or less than 2 standard deviation below the median height, or growth rate less than 25 percentile for age and gender according to the population standards. There are different charts for different uh, growth charts for different populations. So whenever we are examining a child, we have to see the standard growth charts of that population only. And as evident from definition, approximately 3% of children in any population will be short stature children with a stature between -2 standard deviation and 3 standard deviation are more likely to be affected by uh, physiological causes, that is familial and constitutional, while children with stature less than 3 standard deviation below median are more likely to be suffering from pathological short stature. Growth parameters to be monitored. Um, from birth to 2 years, we have to monitor weight, length, head circumference at birth first, then immunization contacts whenever the child is coming to you 6, 10, 14, 9 months, and 15 months, and 18 months. But an additional visit of 6 months is also desirable. So at this time of contact, you can take all the growth parameters like weight, height, head circumference during these times to monitor the growth. Then between 2 to 8 years, height and weight at 6 monthly, then calculate BMI and record SMR, Tanner staging in a child beyond the 6 years annually. 9 to 18 years, annual assessment of height, weight, BMI, and SMR, that is the sexual maturity rating. And growth can also be assessed at the time the child is brought for any other reason to the physician. That time also you can record all these things. What is the significance of growth monitoring? क्यों करना है ये सब हमको? Monitoring the growth of an individual and detect growth abnormalities as soon as possible. Monitor nutritional status also, so you can give the dietary advices at the appropriate time. जब तक ज्यादा नुकसान नहीं हो पाए उसके पहले हम उसको एडवाइस कर पाएंगे. ट्रैक द इफेक्ट्स ऑफ मेडिकल और न्यूट्रिशनल इंटरवेंशन. Then what is the normal growth? Length at the birth of a baby is average at 50 centimeters. Then length at 1 year age is 75 centimeters. So there is an increase of 25 centimeters in 1 year. Then height at 4 years, height at birth into 2, that is equal to 100 centimeters. If the height was 50 centimeters, you expect that 4 years the baby should be 100 centimeters. Height at 13 years is height at birth into 3. So a baby doubles height by the age of 4 years and triples at the age of 13 years. So you see the maximum growth is during the first year. Then from 2 to 12 years in between, if you want to calculate roughly the height, there is a formula: age into years into 6 plus 77. Suppose you want to see the what should be the height at the age of 3 years. So 3 into 6 is equal to 18 plus 77. It will be equal to 95 centimeters. So expected height at 3 years is the 95 centimeters. Now, what are the abbreviations I'm going to use during this lecture? You should be aware of this. SS is short stature. FSS is the familial short stature. CDGP is the constitutional delay in growth and puberty. HA is the height velocity. MPH is the mean parental height. BA is the bone age. CA is the chronological age. HA is the health age. And LDDST is the low dose dexamethasone test done for initial diagnosis of Cushing syndrome. Now, what are the causes of short stature? You can learn by this mnemonics. Is nice. What is nice, and what does this stand for? So I stand for idiopathic. That is, are the most common constitutional delay or familial short stature. And I also stand for the intrauterine causes like intrauterine growth retardation, Torch syndrome in the mother, or fetal, if the mother is consuming alcohol during pregnancy. And then S stands for skeletal causes like dysplasia, osteogenesis imperfecta, spinal defects like scoliosis and kyphosis. Then N is for the nutritional, that is undernutrition, and nurturing, that is deprivation. I is heterogenic like steroids. The child may be on the long-term steroids or radiation due to some any malignancy. Then C is for the chronic diseases and chromosomal like Turner and Downs. And E stands for endocrinal causes like growth hormone deficiency and hypothyroidism. Now, next is the uh, short stature and its evaluation. How to do? You have to take a history in detail, proper history and physical examination. Then growth assessment has to be done during examination. Then you have to measure the growth velocity. Then you have to take mid parental height, and then in the last you have to assess the bone age also. So we will take everything in the detail one by one. So initial evaluation of the short stature. What to do? You have to do first anthropometry, that is height, weight, head circumference, arm span, upper segment and lower segment ratio. Then dysmorphic features you have to see. What are the dysmorphic features present, if any, in the child? Then its nutritional status, what amount of calories needed and what he's taking and what is the calorie deficit. Is it responsible for the short stature? Is it so much that it can cause short stature? Then thyroid gland, we have to assess its functions by the thyroid function test. Then Tanner staging for puberty development. Then neurological examination, you have to see visual acuity and visual field nystagmus, signs of hydrocephalus, and focal signs. Now, measurement of length. Length of children less than 2 to 3 years is, can be measured by the infantometer. As the child cannot stand or can stand, he cannot cooperate and he cannot understand your instructions. So you should take the height by the infantometer. But after 2 to 3 years of age, you can take the height by the stadiometer. Okay, this is the stadiometer. You know how to take the height. You have to ask the child to stand erect with occiput, shoulder, buttocks, and heels touching the vertical bar, and look straight, Frankfurt's plane parallel to, and then the horizontal bar is lowered to the vertex to the child and take the reading. It will directly give you the present height of the child. Now, how to plot the height on a growth chart. So you know this is the x-axis and this is the y-axis. And suppose we are taking an example of a 6-year-old child whose height is 102 centimeters. So draw an imaginary line along the x-axis. It will be age, 6 years of the child. So here is the 6 years of the child. Then extend the imaginary line along the y-axis till the height of 102 centimeters is achieved and mark this point. So this will be the height of your child on this growth chart. Yeah, time है अभी. Now calculation of height, age and weight age. How to, so again we are taking the example of 6-year-old child. His height is 102 centimeter, weight is 22 kg. And so we will see the his height, where it is height coming height, we have plotted 102 centimeter. it is coming at the 4 years of age. So his height age is 4 years. Although his age is 6 years, but his height age is 4 years. And weight age is 8 years. But his weight, when we are plotting the weight, it is going on the 8 years of age. So his height is less than his actual age, but his weight is more than his actual age. That is the weight age. Now, mean parental height. How to take the mean parental height? For boys, means parental height is the maternal height plus father height and plus 1.3, and it is divided by 2. 13 and it is divided by 2. For girls, mean parental height is maternal height plus father's height minus 13 and it is divided by 2. And tenor ranges mean parental height plus minus 6 centimeter. Target range is this one. Mean parental height plus minus 6 centimeter. Height of a boy is 103 centimeter. Father size is one. We are taking example. 160 centimeter. Mother height is 140 centimeter or 47 centimeters. So mean parental height will of the boy will be, this is the maternal height plus father height plus 13 minus divided by 2, it will be 160 centimeters. So target range is 160 plus minus 6 centimeters. That is minus 6, that will be 154 and plus 6 is the 160 centimeter. So this range should be between the 154 and 166 centimeters. This is the target range. Okay. So now you have learned how to take the mean parental height and how to plot it on the chart. Plot mean parental height and target range on the growth chart. So extend the 6 centimeter above and below from the mean parental point, that is the target range. Extend 6 centimeter below and above on the. And when you plot, this should fall in this range. If it is normal, it should fall in this range. Extend an imaginary line backward from the lower end of the target range till it reaches to the patient's height. If a short child's height is above this line, the child is familial short stature. If it is below the child's, it is pathological short stature. So when you have taken the range, if it is falling below this range, then it is the pathological short stature. Okay. So now we will learn what is the difference between the familial short stature and the constitutional delay. So what are the features which will be taken into account? Parent stature. Uh, Familial short stature, it will be small, one or both parents will be short. While in constitutional delay, both the parents will be of the average height. Then parents' puberty, usually in the timing on the familial short stature, but constitutional delay, it is delayed in the parents also. You will get the history. Birth length, it is normal at the familial short stature, and it will be normal in the normal, or it can be slow. Birth length will be normal in the both the cases. Then growth will be normal in the cases of familial short stature, while it will be normal or slow in the constitutional delay. Growth puberty, it will be normal in cases of familial short stature, while it will be delayed in the CDGP. Then bone age, it will be normal in the familial short stature, while it will be in CGTP, it will be delayed. In timing of puberty, it will be normal in FSS, while it will be delayed in CDGP. Then puberty growth rate, it will be low range of normal in FSS, while it will be diminished in constitutional delay. And adult height, final adult height will be short in FSS, while it will be normal in constitutional delay. recording देखो तो सही